Congressman Bill Cassidy is here to talk about health care reform. Just recently, the Senate passed their own version of the health care reform bill. He's worked in health care for many years, both as a doctor here in Baton Rouge and in the public health care system. Congressman Cassidy, thanks so much for joining us.
Carolyn, thank you for having me.
And I know it's early this morning, but I know you're used to getting up early, both dealing with here in Washington. You've been going back and forth, right?
We have been going back and forth, yes. About every week. Every weekend I'm back here almost. And then I go up on Monday or Tuesday and come back on Friday or Thursday.
So what do you think of all that's happened in Washington, this big legislation moving forward? What do you think of it all?
Well, I think it's a bad bill. The bills that have been passed, I think, one, that they are going to cost way too much, that they're going to raise taxes, and when you raise taxes, it's estimated that the House bill will eliminate 5.5 million jobs. Now, as a physician, I've been working at Earl K. Long for 20 years. I also wish that we would do a better job of providing quality care for everybody. I think ultimately quality will suffer as as the cost rises.
And so, with this bill, do you think, though, that reform is needed and this just isn't it? Or do you think that there is no measure?
Reform is needed, absolutely. But the way you do reform is not by making a lot of government bureaucracies, which both of these bills, the House bill, for example, creates 111 bureaucracies. On the other hand, the way you do it is you put the patient in the middle. If you say to the patient that you've got the power to make decisions that are good both for your pocketbook but also for your health, she'll make the right decision every time. That's the way you control costs. That's the way you make that patient healthier. Well,
included in this bill, and there's been lots of talk about the Louisiana Purchase. Landrieu was able to get some funding for the state, Mary Landrieu. What do you think of that? And does that outweigh some of your, disgust for the health care reform, or no?
Well, of course, that $300 million will be well used by the state. On the other hand, the long-term cost of this bill to the state of Louisiana is going to be greatly more than that $300 million. Every year when they have a fight in the legislature and they cut everything else in order to support Medicaid, that will be because of this bill. So I don't think it was Mary selling her vote. I think she actually believes in this bill. That $300 million will be a pittance compared to what our long-term costs are.
Well, and in terms of a doctor in the community, how do you think it will affect the average everyday doctor? Because I know several of them have talked about it possibly hurting their bottom line, and it's not cheap to go to med school and all of that. How do you think it will impact the local Louisiana doctor? Well, all doctors, really.
The thing that disturbs me about the Senate bill is that it's so deceptive. The way that it saves money, it says that next year, 2010, they're going to cut all physicians' reimbursement from Medicare by 20% and never raise it again. So imagine that 20 years from now, we're going to be paying physicians 20% less than they earned in 2009. That's just not going to happen. But yet that's how they establish that this saves money. So it's deceptive. So if you're a physician practicing, or if you're someone on Medicare who has to see your physician, unless that's changed, that physician will not be able to see you. She just won't be able to afford to. So I'm very concerned about this bill on that level as well.
Well, and speaking of deception, we've seen so many different ads throughout this process, and it's really hard for the average viewer or average citizen voter to understand exactly what's in the bill. Has it been hard for you all to kind of digest it as it changes throughout this process?
Well, I've read the bill. I've read the House bill. I've read it more than once. The Senate bill I've read parts of, but it's changed so much in the last week. Over Christmas, I gave myself a break. But you end up understanding the basic framework. So last night I was reading the Congressional Budget Office report, and that's where I saw that the way they balance the budget, the way they make it look like it saves money, is that they cut Medicare reimbursement to physicians by 20%. Well, frankly, someone on Medicare, the physician will not be able to afford to see that patient. And so that will not work. And yet that's the smoke and mirrors that makes it seem as if they're saving money. It's disturbing.
So I guess the fight, you continue to keep pursuing it in Washington, and not quite over, huh?
Well, I've been in Washington for 8 months, and I have to admit I'm disappointed in the process. This is Washington at its worst, where it's deceiving the American people, where it is doing things like Senator Nielsen, who supposedly is pro-life, but this bill, the Catholic bishops have rejected, the Right to Life Foundation has rejected, saying that it's basically going to fund abortions with federal dollars. But yet nonetheless, because Nebraska got taken care of, he gave up on his principles, if you will. And so that's Washington at its worst. It's been disappointing. On the other hand, unless we all work to change it, it will always be that way.
Well, I appreciate you coming this morning, and I know that some of these political games aren't new. You were also a senator here in Louisiana in the legislature, so you've seen some of it, unfortunately, in the past.
Yes, I have.
Well, thank you so much, and we'll be back just right after this.